Good morning, everyone. We've just hit 8:30, so we'll kick things off. Look, on behalf of Ord Minnett, it's my pleasure to kick off the Australian Healthcare AI Conference today. My name's Tom Godfrey. I'm the Head of Healthcare Research here at Ords. And look, this is a sector we're very excited about as a franchise. Today, we're very proud to bring 6 of the key ASX listed and private innovators in the sector that are making names for themselves at a global scale. Together to present their stories to you and how they're leveraging AI both directly into their products but as a key enabler across their businesses. To kick things off, we've got Oneview Healthcare. I'm very pleased to introduce James Fitter, CEO of Oneview, to hear more about their AI journey. James, if you're happy for me to, I'll pass to you for the presentation and then we can kick on to Q&A.
Fantastic. Thanks, Tom. Good morning, everyone. Much appreciated. Great to be here. And I have tried to tailor this presentation to fit the agenda today, so I hope we find it of interest. So what we're going to try and cover is, obviously the issue we're addressing, which is the massive capacity problem in healthcare in the United States. We're going to talk about our specific journey over the last 3 years as we've really embraced the AI opportunity in front of us, as pretty much every self-respecting software company in the world has. We're going to introduce Ovie, which is the first AI product we've developed as a company. Going to talk a lot about proof and trust and economics, which are absolutely critical in healthcare, and how we thought about governance for AI. And then Tom's asked us to think about why we win and what are some of the sort of defensibility issues that we'll cover off today. So anyone who's unlucky enough to be in hospital recently will be familiar with the image on the top right of this slide, which really speaks to the capacity problem that we have in nursing across the world. The World Health Organization estimates that we have a nursing shortage of close to 5 million nurses by 2030, and that is a problem that's getting worse, not better, for a whole host of reasons. I'm going to talk fairly specifically about the United States. The United States, whilst we've enjoyed commercial success on 4 continents and began our success in Australia, as it happens, nearly 85% of our business today is in the US, and the US is obviously a market that has a massive capacity problem, as we're going to look at here. So for those of you who will be pretty familiar that in the United States, healthcare spending is the largest budget item in the United States, larger even than defense, which is a staggering statement. They spend over $5 trillion, or 18% of GDP, on healthcare. And nearly a third of that goes towards hospital care. And this is the public sector only, I should stress, not the private sector. And labor represents 56% of total hospital costs in the United States. And the single largest line item for every hospital is nursing, which represents around about 30% of hospital costs. So that's a $480 billion opportunity, and we are really focused on how we can help address what is a real crisis. And it might just be worth having a think about how we found ourselves in this place. So contract and travel nursing has long been an established part of the US network, same in Australia. There's a lot of part-time nurses who move from site to site. Typically, this was an $8 to $9 billion spend across the system in the United States. But you can see in the pandemic, the staff shortages led to massive inflation in travel nurse wages, which in some states got to over $100 an hour, and saw this massive peak in spending on travel and contract nursing. And what's most interesting is that here we are nearly 4 years after the pandemic, and we've settled at a level that is still about 70% above the pre-pandemic level. So the contract nursing issue is still alive and well, although obviously off the pandemic peaks. And whilst that money problem has eased slightly, the people problem hasn't. So prior to the pandemic, around 1 in 5, this is an annual survey that McKinsey run, where 1 in 5 registered nurses in the state said they intended to leave the profession. That jumped to nearly 33% at the peak of the pandemic, and unfortunately it stayed there. So still today, around 1 in 3 nurses plan to leave the profession. A couple of the dynamics here: the average age of a nurse in the United States is over 56. And 1 in 6 nurses in the United States is a first-generation immigrant. And I think we're all aware that we don't have a particularly immigrant-friendly administration in the US right now. So that's putting further pressure on the nursing crisis. And that cost of nursing has obviously shown up on the bottom line of hospitals. So this is the operating margins for the US health system, which typically pre-pandemic we had about a 6 or 6.5% operating margin. Ironically, they peaked, and the peak in 2021 is really a function of the money that was thrown at the problem by the federal government. So a huge amount of support came into the system. But as that support is drained out, you can see that we've really seen a very significant challenge for hospitals post-pandemic. We're still not back to pre-pandemic operating margin levels. And I think what we see in our own business was really only in 2024, 2025 last year, where we started to see hospitals actually have the financial ability to invest in technology. So what we know, as we've just described, is we can't hire our way out of the problem. The global competition for nursing staff is intense, and no shortages are not going away. The clinician burnout is still as significant as we saw earlier. And of course, the other problem we have is that we're all getting older and living longer. So the Urban Institute in the US has estimated the number of Americans over the age of 65 is doubling between 20 and 2040. From 40 million to 80 million, and 65 is the age that we typically tend to start needing to avail of hospital services. And then throw into the mix, we have obviously consumerism has finally arrived in healthcare. So we have rising patient expectations around the type of experience they're going to enjoy when they are in hospital settings. So I want to talk a bit about our journey. Obviously, AI has become a flavor of the month, but it wasn't quite as much so in 2023. And our journey really began, I took it upon myself to apply to go and study AI at the end of 2023 at Oxford University in their AI for Business program, which was a cohort of 60 students selected from around the world from over 23 countries. It's a highly competitive process. I was one of only 2 CEOs on the program. The vast majority of people there were machine learning experts and data scientists from around the world, most of whom were tasked of delivering an AI strategy for multinational companies. So it was a real privilege for me to be surrounded by them, and it was also a real challenge for the academic staff to teach us a field that was obviously changing in real time. But it really helped me understand, as the leader of a software company, where we needed to go, how we needed to embrace the changes that were happening before us. And that began the journey which we're going to talk about today, and where we are on that journey. And we're still working our way through it, but I think it's really equipped us to understand what the opportunity is and what the challenges are. So if we just go back, I'm conscious some of you may not be as familiar with Oneview. So let me just talk a bit about our core platform and what the business was really focused on prior to AI. So as the name of the company suggests, we provide one view into a whole disparate bunch of systems that typically don't talk to each other, which is one of the many curses of healthcare, with a desire to put technology at the bedside to get the patient home safer, faster, better informed, less likely to readmit. So we have a really sophisticated back end and a very graceful front end. This is the new UI, which we're rolling out in the 4th quarter of this year. And it has AI embedded in it at the heart of what we do, which is obviously really important. So we have been focused historically on patient experience, giving systems the ability to put this technology in a room as a competitive differentiator. In a hyper-competitive market in the United States, it's really important to try and keep patients within your network. So if you can deliver a brilliant patient experience, they're much more likely to stay with you and also recommend you to others. We made the decision as we built the company. We've enjoyed our first commercial success 13 years ago, so we've been on this journey for a while. And we really focused on data, because ultimately data is, we need to be able to measure how engaged patients are in their own care. And as I think all of you will understand, that data is obviously what feeds AI, and that has left us in a very competitive position. So the value proposition here is to effectively think of us as like the enterprise app store at the bedside. We are integrated into the meal ordering system, into the electronic medical record. So we have the context of who the patient is, why they're here, what's their diet code. And we're using the platform to try and liberate nursing staff. So for example, at NYU, as example here, we are integrated into the building management system. So the patient can control their room environment. They can control the lights, the air conditioning, the blinds. The reason that's so important is that every time they're doing that, they are avoiding a nurse call event. And every time we avoid a nurse call event, we can save between, this is our own customers' data, between 2 and 10 minutes of nursing time per request. So whether that's ordering a meal electronically, completing educational content on the platform, triggering a service request that goes away from the nurse to a more appropriate resource, is how we delivered value prior to the pandemic. Sorry, let me just jump forward. We've also got the privilege of having, this is a great line I heard at a conference earlier, it's not my line, that enterprise sales move at the speed of trust, and we can really vouch for that. One of the challenges of enterprise health is the sales cycle is typically a multi-year sales cycle. But what's really helped us on our journey is we have been partnered with some of the most sophisticated health systems in the United States, in some cases for over a decade. So UCSF Health in California's #1 hospital in San Francisco. It's in the heart of Silicon Valley. They are one of the most progressive institutions in the country. They really helped us understand what our journey was going to be like. NYU Langone is the #1 health system in New York. They have over 1,000 people in their IT department and is one of the global leaders on clinical AI. So they've been incredibly helpful in helping us shape the journey. And our most recent enterprise customer is Oneview Health, again, the #1 health system in Washington and Virginia. And Oneview, I would describe as one of the nation's leaders on the virtualization of care, which we're going to talk a lot about today because it's one of the key drivers of our adoption. So customer acquisition for us has seen a dramatic acceleration post the pandemic. The reason for that is the virtualization of care. So you can see here in the last 5 years, we've won twice as many health systems as we did in the prior 7. And that's a function of this virtualization, which we're going to talk about. When the pandemic hit, we had a lot of feedback from our customers saying, what can we do to help? And we approached them and said, what we do to help? And this really started the process of digitizing workflow. So if you've been in a hospital in Australia or in the United States, I can promise you there'll be a whiteboard in the patient's room where the nurse is expected to come in and write your expected discharge date, any precautions you might have, allergies, contact numbers. It's a very manual process, and that manual process really broke down during the pandemic because nurses admitted they didn't have the time or the energy to keep that information up to date. Similarly, outside the patient room, if a patient has an allergy, you'd often see literally a paper sticky would be put outside the room. So what we did is we worked with a number of our customers to basically digitize that process. So we now take those precautions automatically from the electronic medical record. We surface them on the whiteboard in the room and on the door sign outside the room. And that has driven, again, a really substantial efficiency for nurses. But it's the virtual care piece that really is rewiring the inpatient model. And it's also the kind of the nexus of where AI and computer vision are coming in healthcare. So this is the ability for us to effectively act as the conduit for the delivery of virtual care. So what we did is we set up a virtual care API. We have now verified 5 of the leading virtual care companies in the United States and globally to basically host them on our platform. So behind every television in the room, we have a compute device. Through that compute device, we are supporting these virtual care companies. And this is leading to every use case you can imagine, from patient sitting, patient observation, to really take pressure off the floor nurse. So the most pronounced example here is patient sitting. So patient sitting is a legal requirement for patients that are suicide risk, they have delirium, they have dementia. You have to have a physical sitter in the room 24/7. So what happens here now is we have the ability where we have a command and control center within the hospital. We have a camera with a microphone and a speaker array running through our compute device behind the television. We get a message that says that the virtual care team want to take control of the TV. We pass control to them. We pause the entertainment in the background. And now the virtual nurse is in the room. And if it's a sitter, that person will be there 24/7. but that sitter is now monitoring between 6 and 10 patients concurrently in real time versus the one-to-one model. So massive driver of efficiency for the floor nurse. The virtual nurse is also proving to be very a real positive for patient experience, because the patient has the undivided attention of the virtual nurse. The floor nurse is obviously distracted by alarms that are going on around the ward, maybe in the process of onboarding a patient or discharging a patient. They'll get distracted. With the virtual nurse, they're always there. It's a much easier line of communication, better experience for the patient. And in a number of academic studies that have been published in the US, we're now seeing that this virtualization of care is leading to somewhere between a 40 and 60% improvement in the productivity of the floor nurse, which is tackling the critical issue which we discussed at the start of the presentation. So for us, we are that patient room technology which is enabling the virtualization of care. We have been the conduit for it. We've done it in the pandemic. We did it on tablets. That was a good use case, but not a great use case, because the tablet's not always facing the patient. But we know the TV is always facing the patient, and there's also a legal requirement to have a TV in every room in every hospital. And my belief is that every hospital in the United States will have a virtual care camera in every room in 3 to 5 years' time. That's what drove 25% growth, top line growth for us last year. We expect that's going to continue for the foreseeable future. And as we move forward, that use case I described, where there's a individual monitoring 6 to 8 patients, that will be done by AI with the advances that are coming in computer vision. This is not yet ready for prime time, but it's being piloted in a number of hospitals that we're working with in the United States. And that ultimately is where we see the business heading. So just to give you a sense of how our platform changed, prior to the pandemic, we had the tablet and the TV. We now have the digital whiteboard, the digital door sign, and we've also introduced MyStay Mobile, which is the ability for patients to access a lot of the functionality as described on their own device. And these new product suite has given us the ability to effectively upsell our customers by nearly 100%. So let me talk about Ovie. So Ovie was the next evolution as we thought about how do we think about product development for AI for ourselves. So Niall O'Neill, who's our Chief Product Officer, who also took it upon himself to go back and get educated around AI at the same time I was, went out and engaged with all of our customers globally. He had put forth a bunch of potential use cases. I think he had 18 use cases when he first went out to market, and asked for feedback from customers as to what would be the most impactful. And unanimously, the most impactful was, could we deliver a virtual patient assistant that had contextual awareness on the tablet or on an Alexa-style device in the room to, again, take pressure off the care team. So that was the evolution of Ovie, and what it's now evolved into as we've sat down and started the conversations with our customers around how we're going to deploy this. It's moved into more of a product suite, which is now a 4-product envisage, which started with Ovie Voice, which is that natural language interaction that we talked about. But it's also now giving us the ability to deliver these context-aware patient prompts on the home screen, which I talked about earlier. It's giving us the ability then to deliver real-time operational visibility around how patients are interacting with Ovie, and that will lead to a new product development in 2027 around a rounding tool to formalize that feedback. So what's that look like in a real-world scenario? So this is just a screenshot from that user interface you saw earlier. So what Ovie is doing is it's surfacing what is the next most important thing for this patient to do today. And that might be a survey where we want to understand how well they slept last night. It might be a reminder to order their meal. It might be a reminder that they have a scheduled appointment this afternoon, or to continue watching entertainment, or to watch some educational content. Once they complete that basic survey, is then escalated to the staff member. So now we have a notification being surfaced with the staff that Doug has had a poor night's sleep, and that may impact how they think about their workflow. So it's a very basic but very simple idea of how we can capture noise, signal it. Every time the patient is interacting with Ovie, the AI is analyzing that conversation. It's creating awareness for the care team and allowing the care team to have a better understanding of what they should expect when they walk into the room. So how's this built? It's built on the back end through the complexity of the systems that we're already integrated with. So as I mentioned, we are integrated into the electronic medical record. We're integrated into the dietary system, the education system. We know the patient's age. We know their primary language. We currently run our solution in 50 languages. And we know their context, so and their diagnosis. So Ovie will be is trained to respond in a way that the patient would expect to. So if a 10-year-old child is asking about their medication side effects, it will respond in the voice that a 10-year-old child would expect. And all that is layered through on the back end. It's built on our Microsoft stack, which has been our stack since the company was founded, and has all the layers around security that we'll talk about a little bit more down the road. So why it's different is that it is built specifically for healthcare settings. It has that real-time contextual awareness. It's running on a small language model, which is also open architecture. So hospitals can choose their own model if they want to run it. We can accommodate that. It's got clinical grade privacy and security. So we were the first company on the ASX to achieve ISO 42001 certification, which is something we're extremely proud of. That means that our AI management systems have been independently audited by the International Standards Organization and certified. So if we're going to deliver a product, we have the comfort that our customers have the comfort that they know that we've been independently verified. And this is really designed to complement the human care model, not to replace the human care model. As we know, that is absolutely critical in healthcare. So here's how that fits into the stack of the nursing crisis that we talked to earlier. So obviously the floor nurse is the highest cost resource, the lowest availability. They are delivering compassionate, emotional, physical care at the bedside. The virtual care we are providing through our API, which is providing the ability to deliver complex education, do meds to beds for pharmacy, admission and discharge planning via video, is really powerful. And then Ovie is there at all times, lowest cost to provide common questions, basic education, the ability to request a call with either a floor nurse or a virtual nurse. It's becoming part of the care team and augmenting the care, not replacing the care. And that's obviously critical. So how do we think about proof of value? It's really, so we're piloting this with 2 of the 4 customers I mentioned earlier. Obviously, we're going through the clinical review with them right now to understand what outcomes they want to derive. How do they think about returning time to care? So in the perfect world, we are going to drive efficiency with a floor nurse. The ultimate holy grail from an ROI perspective is if we can actually have an impact on staff to patient ratios. And that's something that is aspirational. We're obviously just beginning this journey today, but based on the information we have from the pilots we're kicking off today, there is a massive interest in the product and a massive demand for the product. So we're super excited to get this in the hands of customers in the coming months. As I mentioned, operating discipline is absolutely critical. Anyone can demo a product. To deploy it across an enterprise at scale is a totally different equation. That's where the ISO certification comes into place. So we are also ISO 27001 and 27701 certified. We're HIPAA compliant. We're currently going through SOC 2 as well. So I can't emphasize enough in healthcare how important that security layer is. And that's what's helping us to deliver at the front. So when we think about AI at Oneview, we think about it on 2 fronts, as I just described, from a product perspective for customers. But the second, and arguably the more important issue as a software company, is how do we use AI to deliver through our software development lifecycle? And that has been a journey that, again, we've been on for 2.5 years. We established a formal AI governance committee first quarter of 2024. That has been transformational for us as a software company. It's allowing us to deliver velocity and quality, I think, is the most important outcome. Obviously, being able to deliver faster is great, but being able to deliver better quality leads to happier customers. So we've started with this philosophy that if we can operationalize AI internally first, it's going to help us to better build AI for external product development. And when we started this journey internally, the most important thing that we agreed as a leadership team was how do we bring our own people with us on the journey? Obviously, there's a huge amount of fear, particularly amongst the younger generation, around what this all means for them. So we really encourage everyone to say, listen, whether you're with us or whether you're with someone else in 3 to 5 years' time, you need to understand what's happening around you. You need to get your hands on the tools. So we set up regular learning sessions. We set up communities of practice. We brought in outside speakers. We continue to do that today. But most important, every employee was asked to set a formal AI learning goal with their manager to make sure that they were coming with us on the journey. And I think that's created a real culture of high agency curiosity across the business. This is another thing Tom asked me to address is how hard is it to be successful in AI in healthcare? And it's really hard. As I said, the sales cycle is chronically difficult. For a new AI project, there's so many ways it can go wrong. You've got to get the workflow integration piece right, which is really our bread and butter. You need clinical champions, you need strong governance, you need demonstrable ROI, and you've got to try and remove that procurement friction. And the way we do that is we're there. We've been in these hospitals for over a dozen years. We're already integrated into their most sophisticated systems. We're a trusted partner. We're operational. We are live in most of our customers in every room in their enterprise, which means we have the footprint and the conduit to deliver that virtualization of care. Why we can move faster is for exactly those reasons. We've already got the customers, we've got the integrations, we've got the certifications, we've got the footprint, and we understand the workflow. So for us to be displaced is really hard. It's really hard to get into these systems. It's arguably even harder to get out if you go about your business with professionalism and a partnership mindset. And for us, it is a true partnership. The economics have to work on both sides of the contract. We are delivering, I hope I've explained to you how we're going to deliver a significant labor savings. We're going to be able to tackle that travel nurse crisis. We're delivering workflow efficiency. We've been doing that already through the digitization work that I talked about earlier, but being able now to use virtual nurses to accelerate the discharge planning process. That leads to faster bed turnover, that leads to better revenue. So there's real operational mileage in what we're doing. And we're seeing that. I mean, NYU Langone, for example, described discharge planning as $1 billion opportunity for them. So the numbers are huge. The virtual care enablement is incredibly powerful, whether it's a clinical, a clinician, a pharmacist, a nurse, a sitter being brought into the room on our platform is massive. And then on our side, we've obviously got the faster development through the work we've done on the SDLC. We're delivering at scale with our current headcount. And as we deliver a better product with greater velocity and more quality, we're getting through our product roadmap much faster than we would previously, which is making us stickier and more valuable for our customers. So how that turns into revenue is through product differentiation. It gives us the ability to deliver, because we're already there, we've already got the credentials as effectively the enterprise app store at the bedside. We're allowing us to move into new workflow categories. As we deliver Ovie, we have already Niall has a sort of shopping list of new AI products that he's thinking through. The virtual care expansion is massive. We're going to get in more beds, more wards. That's going to deliver further revenue. And all of that leads to happier customers, stronger retention. We've only ever lost one customer in the United States. We're incredibly proud of that. And I think this is going to continue to drive significant shareholder value. We're obviously conscious that software, particularly in the micro-cap space, is being derated in Australia. We know the ASX Tech Index has had a rough 12 months. It's down 29% compared to a 30% positive in the NASDAQ and 3% in the ASX 200. We know that why that's happening, but I think we can, hopefully, I think we've described why we don't think we are vulnerable. In fact, we think we're going to be a real winner here because the foundation models are commoditizing. We know about the Chinese open source models, which are becoming more readily available. That means that the strategic value is moving up the stack, and owning the room where the AI is going to run is going to be the real value and the real moat for us. So we're super excited about that value migration. In terms of competition, Tom had asked us to talk a bit about the competitive landscape. We're not seeing the frontier model players tackle healthcare today. The industry incumbent on the electronic medical record side is Epic. They are clinically focused. They are not focusing on the patient room the way we are. We see some point solutions, which is, again, one of the things that all of our customers are telling us is they want less vendors, not more vendors. So the idea of being a platform that is bringing together all of these solutions in one place is what we've been focused on for the last decade, and we think we're starting to see the benefits of that. And then the sensing players, companies like Artisight, very impressive, began their journey in the operating theatre. They're really leading edge from a computer vision point of view, but they don't have the patient experience layer. They don't have the installed base to deliver on, which we obviously do. So these are the 5 walls that we really feel that AI can't code around. We talked about regulation and compliance. Again, I can't overstate how important that is. And again, I can't overstate how proud we are to be the first ASX listed company to achieve ISO 42001. We know the integration and switching costs are massive. Our average contract duration is nearly 7 years. You're not going to move away from that quickly. We have incredible data, hospital-specific data, which allows us to benchmark them against their peer groups. We have the clinical expertise on our teams. We control the physical infrastructure in the room, so whether that be the tablets or the devices behind the television, that requires us to manage that hardware layer, which also has serious complexity. It means we need to manage on multiple operating systems, multiple firmware, and that's not something that's going to be easily replaced. And again, the enterprise trust, I think we've already spoken to that, but being an approved vendor on GPO contracts is incredibly powerful. So why now? It's getting worse on the capacity side. We know the demand for hospital rooms is getting greater. We are seeing the dramatic acceleration of the virtualization of care. We obviously see the maturity of AI. We can see that digitization is happening at scale. We're already in the room. We're not just building the product now, we're really turning that room into an orchestration platform. AI is the catalyst to do that. So I think as we think about healthcare and AI, I'll sort of conclude on this slide. AI is not going to replace the human touch. It's so critical in the way care is delivered, but it is going to restore time for it. And time is money. And I think when you look at the size of the prize in the United States, I think we are uniquely positioned to deliver serious value as we embark on this journey. So Tom, I might conclude my presentation there. You're probably sick and tired of listening to me, and be delighted to take any questions.
Thanks, James. No, not at all. Really appreciate the presentation there. Very comprehensive. We'll turn it over to Q&A. Everyone on the line, please use the Q&A function to punch any questions in, and I'll ask them on your behalf, or feel free to email me. Maybe if I can kick it off, James, it sort of goes to the heart of a lot of what you were just saying. But if we think about your sales team and the funnel in the US, how have conversations changed more recently around your value proposition? Are people inbounding on Ovie? Is it still around ROI and staff to patient ratios? What are sort of the key drivers to get deals done?
I think the key, well, a couple of things have really helped us in the last couple of years. One is that, didn't mention this in the presentation, but Baxter International is one of the largest medtech companies in the United States. Baxter is the largest supplier of hospital beds. They bought Hillrom in December 2021. They're the largest supplier of infusion pumps. They are one of the largest nurse school providers in the United States, and they went out to market in 2023 looking for a connected care partner, and they invited us and 4 of our competitors to bid for that business, and thankfully we won that. So they have been reselling our solution in the United States, and that has really helped broaden the awareness of what we're doing. So we're getting a lot of inbound from that. But if there's one thing that's changed the conversation, it's this recognition that the virtualization of care is the ultimate answer to the nursing crisis in the United States. And in order to deliver that, you need bedside technology. And having a bedside technology platform like Oneview's, which is open, it's scalable. Our philosophy has always been, we're Switzerland, we will accommodate all of those virtual care providers, which we have done. We now have live integrations with nearly all of them. And I think that's been the great driver of demand. Now, the fact that we are then able to talk to them about how could we layer in our AI and also talk to them about the AI that's going to be available through computer vision is really impactful. So I think that's the key catalyst for growth for us.
Great. And maybe just sort of looking at your install base, you've got some really high quality, both academic medical centres and larger IDNs in there. Do you think the conversation is sort of I suppose, moving from, gold-plated AMC deployments to this is becoming mission critical? How do you see that evolving in recent years post-pandemic?
Yeah, it's absolutely mission critical. And the other driver is that the big beautiful bill prima facie wasn't great for Medicare and for payer mix in the US. But what it has been good for is a $50 billion fund set up for rural and community hospitals to avail of. And one of we're seeing a lot of inbound demand from those types of hospitals who are receiving funding grants from the federal government to deliver virtual care. And like in Australia, where you've got this massive landmass, you've got remote communities. I'm thinking of the rural New South Wales, for example, the ability to deliver virtual care at scale in rural settings is going to be really impactful, and we're seeing that already in some of the inbound that we're getting in the US at the moment.
Got you. And I mean, in terms of the ROI conversation, do you guys continuously sort of build your health economics, I suppose, calculator for those conversations around deployments? How is that sort of shaped up with the introduction of Ovie?
Well, that's it, mate. So as Ovie goes live in these 2 pilots in the next few months, we're going to start getting that data, and it's all about nursing time saved. So we're able to do that with meal ordering, with educational teach back, with service requests, with virtual care and virtual sitting. But I think Ovie is going to add a whole new dimension to that, which we're super excited about.
Great. And there was a great slide in there sort of touching on the competitor set, but has that changed post-pandemic? Have you seen people coming into various slices of your market more recently? And I suppose this sort of AI at the bedside, are there sort of challenger players coming through there?
What I'd say is that the category is changing from we were a dedicated patient experience company. There were dedicated virtual care companies. I'd say those 2 categories are converging into this smart room of the future category, or the connected care room, where we want to basically be the operating system for every device in the room. We would like to see Oneview as the operating system that brings all that together and orchestrates that. So for example, the ability for us to use Ovie to communicate with the whiteboard. So the whiteboard, for example, particularly in pediatric settings, for anyone who's had kids in hospital, the frustration of you're waiting around for the doctor to round on your child and you want to pop out for a minute, you can now say to Ovie, hey, listen, I'm just popping down to get a cup of coffee. That note will appear on the whiteboard. So now the care team knows that mum or dad is in the hospital. They've gone to get a cup of coffee. They'll be back in 10 minutes. Those simple use cases that can have a real impact, particularly in pediatric care, I think are going to be really powerful. So how we bring Ovie in to control the environment. So the ability for the patient now to turn off the television, turn off the whiteboard, control the room temperature. The reason it sounds really simple stuff, but this is really important because one of the biggest costs for health systems are the adverse events. So a typical adverse event is where a patient gets out of bed and falls. And the cost of that fall is incurred by the hospital, not by the payer. And one of the most common causes for patients to have a fall is they press the nurse call button because they want to change the room temperature. They're too hot or they're too cold. After they've waited for 25 minutes, they get out of bed themselves, they go to change the room temperature, and they fall. So at NYU, at BJC in St. Louis, and increasingly at all new hospitals, the patient has the ability now on the tablet at the bedside to control the lights, the blinds, the room temperature. They're able to do that using Ovie. So Ovie, turn off the lights. Ovie, change the TV channel. order my meal for me. We think voice is becoming the modality of choice for healthcare. There's been a massive investment in ambient listening for clinicians. So this is the use case where companies like Abridge and Nuance, the care teams coming into the room. I think Heidi's going to be there today talking to you. Heidi's another great example of that, where Heidi is doing the note-taking for the care team. That's a massive win. It's having a huge impact on the efficiency of how care is delivered on the clinical side. We're doing the same thing on the patient side. So I think there's a lot of convergence around voice across the enterprise in hospitals.
Great, makes a lot of sense. Look, some really good insights around AI and your strategic roadmap. Can I maybe focus in slightly more near term? You guys have guidance around sort of where you think you'll get to around hospital endpoints for this year. Can we maybe sort of touch on where you were at the end of 25, the growth into 26, and just sort of near term drivers?
Yeah, so we pretty much said we expect 20% plus growth, for the foreseeable future, and I think we feel really comfortable around that. I think if anything, that might prove conservative based on what we're seeing in the market today. And as those operating margins are starting to get close to normalization, the ability to invest is getting greater. Budget has been a real problem, post-pandemic, but I think what has happened, Tom, is as you know, the one place you never want to be in a hospital is in the capital budget, right? Because you get all these kind of these false signals where patient experience is great, but we want to buy a new Da Vinci robot, or we want to buy some new MRI machines, so you slip down a ranking. Because every CFO has been living with the labor cost inflation of the last few years, the fact that our technology can address that directly has moved us higher up the priorities of the capital budget, and that's really, really impactful.
Got you. And I mean, I really like the line around enterprise healthcare moves at the speed of trust. What have you seen in terms of your typical sales cycle in the US post-pandemic? Is it shortening, or how do we think about that?
It's starting to shorten. I think it's been constrained by budget up until now, but we're starting to see some really positive movement in recent months. And I think it's the outlook's very encouraging.
And I was maybe just going to ask one more. You mentioned the partnership with Baxter earlier. How has that sort of changed, boots on the ground in the US for you guys, your sales process, and how do you sort of see that relationship developing into the future?
Yeah, so look, we've had the luxury of being able to go and train 100 of their salespeople. To put that in context, we have 6 people carrying quota for us in the United States. So it's a massive amplification of the message. And obviously, with any channel, there's variability in the quality and the priorities of their own sales organization. But I think we have good alignment. They have the most unbelievably deep relationships with customers that for a company like ours to avail of. I was out with one of the Baxter guys recently. I just said, as a matter of interest, he picked me up at the train station. We're on the car to the customer. I said, how long have you been talking to these guys for? He said, we've been covering it for 28 years. So I mean, that's the kind of access that we can only dream of. So we're getting a ton of inbound. We obviously have a very structured relationship with them, and we're excited about the partnership.
Maybe just one more. I mean, that's obviously a very positive strategic relationship. You mentioned other players sort of in different parts of the value chain or the room technology stack. Is there opportunities for you guys to do additional partnerships or strategic deals with other players to enhance the value proposition?
Yeah, look, I think it's always, Epic is an interesting partner for us. So one of the more recent announcements we made was a new revenue channel with Epic TV. So Epic is interested in surfacing. Epic has a product called MyChart, which is the ability for the patient to see their clinical record on their own phone. And what Epic has launched with Epic TV is the ability for the patient to see their clinical record on the television in the room. And we have worked with them. They have a bit like an Apple App Store where they have certified our Oneview compute device to support Epic TV. Now, Epic TV is not a brilliant patient experience, but Epic has such a ingrained footprint across the United States that we see them as a great channel to introduce our capabilities. So if we can, and a lot of customers are still cost conscious, so they might go with what we call a less sophisticated patient experience with Epic TV. But if we can support that on our hardware, we then have the opportunity to show them what a great patient experience looks like with our full product. It effectively is a way to get us into the institution and upsell them down the road. And as we mentioned in our most recent releases, we've had a really positive response to the Epic TV initiative. And I think you can expect to see some positive results from that in the near future. And I think between Baxter and Epic, you've got, two behemoths who, between them, I don't think it'd be a hospital in the country that they haven't got exposure to. So to be able to get access through those two channels has been incredibly helpful.
Fantastic. I've had a couple of questions come in online. Maybe just starting with, I'm interested to understand the revenue model. How does Oneview get paid?
Good question. So we charge a price per bed per day. We published our average is €1.51, so call it roughly $2 per bed per day, $2 Aussie dollars, a little bit more than $2 Aussie dollars. So around about $800 per room per annum. That is for our core platform. If we upsell with the digital whiteboard and the digital door sign, we have the ability to double that. So that'll get us to closer to $4 Aussie per bed per day. That's running at around about 90% gross margin. Our overall blended gross margins are in the high 60s, low 70s, because we're still deploying hardware in the room and we only get a lesser margin on the hardware. But it's typically 3 to 5 year contracts, super sticky, as you saw with a number of our customers. We're now entering the third 5-year contract with a number of customers. So as I said, really hard to get in. But if you get in, you prove your value. It's very sticky. We've also, in our 2 most recent price negotiations in the United States, we pushed through a 15% price increase at one customer and a 23% price increase at the other. And that, I think, speaks volumes around the value that we're delivering for our customers.
Great, very clear. Next one was, how do you demonstrate actual time in motion examples of what your solution offers versus existing manual systems to accurately quantify the actual dollars and patient outcomes?
Yeah, so we have a quarterly nursing user group which gets together where customers are actually sharing data from their own experiences. And as we get the pilot data from Ovie, we're going to be in a much more sophisticated place to do that, where we'll be able to automate and collect that data in real time.
Fantastic. I'm not seeing any more questions online, James. Really appreciate the update. It's an exciting time for Oneview. Appreciate you joining the conference, and we will kick it over to Echo IQ in about 10 minutes, everyone. Thank you.
Thanks for having us. Hope you have a great day.
Cheers, James.